So one of the main reasons why people get microneedling done is to stimulate collagen and elastin. I mean, do we not hear that every day in the medical aesthetics industry? Collagen and elastin, biostimulation. And yeah, that's one of the things, but the skin pens do some really cool other things.
You're listening to Just a Pinch podcast with Injector Kristin. Join me and industry experts as we discuss the good, the bad, and the ugly of the aesthetics, wellness, and fitness industries.
All right, welcome back everybody, and welcome to Season 2, Episode 1 of Just a Pinch podcast. I am your host, Injector Kristin, physician assistant, located here in Avon, Connecticut. So it has been more than a hot minute since you have heard or seen me on here, and there's a really good reason for that, and that reason is I opened up Ethos Medical Aesthetics and Wellness. So now I am the owner of my own practice and I can do things my way and my way only. And my gosh, has it been a blessing, and it has been wonderful. So Ethos opened their doors at the end of May, and we have been cruising ever since. And we're doing everything medical aesthetics, lasers, injectables, and then I brought on a really cool big piece in the wellness. So wellness is going to include things like testosterone replacement therapy, nutritional support, peptide therapy, medical weight loss. You name it, we got it. We've got a heck of a bag of resources here for all of our patients in the wellness industry here. So that's just my little spiel on Ethos. That's what we've been up to, but let's chat more about Just a Pinch. So what can you expect from this season? So this season is going to be pretty darn similar to the last. You're going to hear some solo episodes like today. You're also going to see some in-person guests, some co-hosting, and then of course some distance guests as well. I want to get as many professionals and people that I think that you need to hear from on here so that you can hear their opinions as well and not just mine. So today we're going to keep it kind of light and airy, and we're going to talk about one of my favorite things, which is microneedling, all things microneedling. So we're going to chat a little bit about skin pen based microneedling, and I'm going to be referring to it as skin pen. That is a brand name. It is also a type of microneedling. And then we'll also talk about radiofrequency microneedling as well. So to get things started, what's the history of microneedling? Well, microneedling has been around for a long time. It started off very rudimentary with physicians and medical providers literally going through and using a needle to create controlled trauma into the skin to help stimulate a cascade of healing growth factors out of the skin and the tissue. But that's really redundant. It takes forever to do. It is painful. There are better ways to do this. So the next iteration of microneedling was derma rollers. And you'll still actually see some of those around today. I don't like them. They are on my no list. And what they ultimately are is they look like a roller, almost like a paint roller, small form, and it has all these little spiky needles coming out of it. Now, the reason why I don't like it, because as you're rolling, these needles that are straight are on something that is cylindrical, right? So if we have a circle and all these little needles around it, as that is going in and out of your skin, it's not doing it in and out straight the way that a pen would or an injection would. On a roller, they're entering the skin at kind of random angles, and they're coming out of the skin, in some cases almost ripping and tearing at the skin. So I don't like it. I don't like it at all. You'll still see some companies using them today. You'll still see them being used in some clinics today. Not my thing, not what I recommend. Do not buy one. Also, once you use it once, those needles are dull. You can't re-sanitize them. Even if you could put it in an autoclave, those needles are dull now. So no to derma rollers. So the next type of microneedling that came up was the skin pen style. And there's a bunch of different brands out there. I'll be referring to mine as skin pen. There's the brand that I use that comes from the company Bellis. And so a skin pen ultimately looks like a pen or a stylus, and it has one-time use cartridges that contain those needles that you put onto the pen. And then that pen itself contains a little micromotor which will cause those needles to go up and down and in and out of the skin. Kind of think along the lines of a tattoo machine, the way that those needles go in and out and kind of buzzing. This looks and sounds very similar, but a very different style of design per se. So the way that these skin pen devices are developed, there's a huge range, and not all of them are safe. Not all of them are FDA approved. And when I say not all of them are safe, it doesn't mean that, oh, the needles aren't sharp or the needles aren't going to go to the depth that they're saying that they're going to. When I say they're not safe, my main reason for saying that is the fact that they can have cross-contamination. So a big factor when choosing microneedling devices is how clean are they? Has the testing been done on them to say that they do not have cross-contamination, that the blood and plasma and cells from one patient aren't getting lodged up into that pen and then getting put into somebody else's skin? I mean, there was a really, really unfortunate thing that happened in the Southwest United States years ago, and I think that lawsuit is still going on, and HIV was spread. And correct me if I'm wrong, I am 99% sure it was from microneedling, using a device that was not sterile. I don't know if they were reusing needles or if it was just the device itself that was having that cross-contamination, but either way, no bueno. So, I mean, that is like the worst case scenario, to be spreading around, a bloodborne virus like that. So it's a huge thing that you need to think about. And one of the main reasons that I bought the Bella Skin Pen is that I know that that's not a problem in their actual design. So that's not a design flaw that I have to worry about. I know that the cartridges that go on are one-time use, that we're not going to be getting bloody fluids up into the actual pen device. It has a sheath that is one-time use to cover it. It's like a little microneedling condom. So that way my hands are not cross-contaminating onto the device as well. So I love the device for that. So that's something to really take into consideration. And when you are going to a med spa, dermatology office, wherever it is that you're going for your microneedling services, ask what type of device that they use. It really matters. Is it a device that was purchased off of Amazon for $100? It's going to look pretty similar to the real ones and the medical grade ones, but they're not. And those don't necessarily come with all of those built-in safety precautions. So ask to see the device, ask what brand they use. And if they won't tell you, are beating around the bush, can't show you packaging, don't do the service. Don't do the service. This is your skin, your body, your health. If your provider cannot show you what type of device they're using, what brand it is, where they came from, seeing them open up brand new cartridges to put the tips on, don't get it done. Enough. Don't get it done. It is not worth it. If you lose a deposit, who cares? Fight for it later if you want. Don't get the procedure done that day. So, off of my soapbox when it comes to microneedling safety here. So these pen devices are really nice because you can choose what depth those needles are going into. Things like derma rollers, they're set to one real depth. And like I said, don't use them to begin with. They're trash. I don't like them. But the pens, you can actually choose what depth you want those needles to go to. So you can give a really fine-tuned and tailored treatment to your patients, or get a fine-tuned treatment yourself. Okay, so what are we trying to accomplish with microneedling? Why are you getting this procedure done in the first place? So there's a variety of reasons, and a lot of the reasons you're probably completely unaware of. All that you know is that it makes your skin look great. So one of the main reasons why people get microneedling done is to stimulate collagen and elastin. I mean, do we not hear that every day in the medical aesthetics industry? Collagen and elastin, biostimulation. And yeah, that's one of the things, but the skin pens do some really cool other things. So they can help with pigmentation, so dark spots, and it's going to do that by creating that trauma in the skin with those microneedles. We're releasing a big cascade of growth factors. Ultimately, we're stimulating stem cells that are in the skin. And all in that basal layer of the dermis, all of these growth factors are being released, and they're all going to do different things. Now, we can't pick and choose what they're doing. So they're doing it all. So when you get microneedling done, you can't really say, oh, I'm getting microneedling for pigment, or, oh, I'm getting microneedling for acne. So when you get microneedling done, you're doing it for all of the reasons. So with pigmentation, it's helping regulate the melanocytes. The melanocytes are responsible for creating melanin or pigment in your skin. It's also going to help regulate oil glands or sebaceous glands. So it can help down-regulate and normalize them. So if you're a big oil overproducer, microneedling may be really beneficial for you in that aspect. It's also really good for rosacea. Now, initially, you may actually feel like you get a little bit of a rosacea flare. It can create that redness and that erythema. But ultimately, the way that it's going to help with rosacea is it's going to help thicken the skin, collagen and elastin, thank you. And it's also going to create some angiogenesis. So we're going to get some new blood vessel formation and healthy blood vessel formation. It can help kind of solidify and create a really good base in that capillary bed where we see things like vascular rosacea being a problem. So when we see all those little tiny superficial vessels on the skin, oftentimes they're just too close to the surface. They're at a layer where they shouldn't be, and the bed that they sit on is kind of a craggly mess. So if we can solidify that capillary bed, those capillaries can sit nice and kind of solid on that bed, and then all that nice thickened skin will sit right on top of it like a little sandwich. We want a little capillary sandwich here, and you can actually help reduce redness and reduce the appearance of those little broken blood vessels or visible blood vessels in that case. So really great for that. Now you can also microneedle different areas like the scalp. And why would we do it for the scalp? Not only for skin cell turnover, but we're going to do it for some hair growth. Now, it's not going to necessarily cause you to grow new hair, okay? What it's going to do is it's going to create stimulation in all those little stem cells that are surrounding the hair follicle. The hair follicles are responsible for growing your hairs, and when they're going through those different growth phases, all of your hairs don't always grow all at once. So you have some hairs that are in the anagen phase, so they're actively growing, and they are just, it's what you're seeing. All of my hair here is in anagen phase. You're also going to have hairs that are more dormant. So they're not, the follicles are there and they're healthy, but those hairs are not actively growing. This is also the mechanism for why with laser hair removal, we have you come in every 4 to 6 weeks because we're trying to catch your hair growing in those different cycles. You might notice that some months you seem to have no hair growth and other months you're like, what the heck, I've got tons. It's because of that growth cycle. So when we microneedle the scalp for hair rejuvenation, we're stimulating those stem cells that are around the follicle of the hair. What we're trying to do is get more of those hair follicles to be in active growth cycles. So trying to get more of them into that anagen phase. So that's another way that we can use microneedling in kind of a different way. Still on the scalp, still on your body, but for a whole different reason. Now, microneedling can also be used as a skincare product or drug delivery system. So you can choose to put certain types of products onto the skin or onto the area that you're microneedling. And as you're microneedling, it's going to drive it into the skin or into the tissue. So when we're doing hair restoration, you can actually use minoxidil, and you can put different types of hair peptides and hair growth factors on the scalp. And as you're microneedling, it's driving it into the skin. So that way those really potent ingredients are going to get right around that hair follicle, kind of like adding a little lighter fluid to your fire. And you could also use this with exosomes. Exosomes are amazing. Right now in the United States, they're not approved to be injected, but you can use them topically. And when I say topically, are we in kind of a gray area when we're microneedling them in? Probably. Not gonna lie to you there. We're probably in a gray area. You can also microneedle and then just put it on top. So you're not driving it in, but you're letting it absorb into the skin. There's a workaround, an alternative. Otherwise, when we're microneedling the skin of the face or the neck, chest, anywhere on the body, we're going to be using products like hyaluronic acid, different types of growth factors. There's different brightening agents and pigment fighters. There's all sorts of things that are approved for the use with microneedling. Not everything can be microneedled into the skin either. So just because it's a skincare product does not mean that that's okay or that that's safe. So make sure that with your treatment, what's being put on you is okay to be done with that. Otherwise, you can create a lot of problems in your skin, and we don't want to do that. We're creating a wound. We want those products to be sterile. So that's super important. We don't want to be creating an infection based on the product that we're using to microneedle into your skin. Now, how painful is microneedling? Honestly, it shouldn't be. It's normal to have a slight little bit of discomfort, but you should not be white knuckling through this. I think that the use of numbing cream is necessary. I think that if you're not, that's by your choice only, but your provider should definitely be offering you at least a topical numbing cream. I don't think you need more than that, but a topical numbing cream, anywhere between 15 minutes to an hour, depending on the strength of the cream. And it needs to be fully removed. If that numbing cream is not fully removed from your skin, and now we're driving those microneedles in, you could actually be pushing lidocaine and other ingredients into the skin, which we don't want to be doing. So we need the skin to be really clean, and we need it as close to sanitized as possible, using things like a skin grade rubbing alcohol or hypochlorous acid, chlorhexidine, any type of good skin disinfectant prior to, because again, these are needles. We cleanse your skin before we inject you. You should have your skin fully cleansed before going through microneedling. Now, in my opinion here, I think that with microneedling in general, not all, but a lot of providers go really overboard and overkill with how they perform their treatments. Deeper is not better. It is not. And I will repeat that again. Deeper is not better when it comes to microneedling. The only time that you should genuinely be going deeper than 1.2, 1.5 at the max millimeters is if you're going over thickened scar tissue. If you're treating really thick scars, then okay, I totally get it. You need to go up to maybe 2, even 2.5 millimeters, 3, and let's call it a male with thick scarred skin. And that's spot treated. You are not going deep 2 millimeters and dragging it across the skin. You're going to create so much trauma, and you're going to end up in worse shape than before you came in for the treatment. When we're microneedling, our goal is to trigger that cascade effect of growth factors, like I mentioned a few minutes ago. And the trigger point for that is in the dermis, and the dermis is not far down. It is that middle layer of the skin, so we don't have to go far down. In some areas, you can hit the dermis at 0.25, 0.5 millimeters, 1 millimeter. It's not deep. So with that being said, not everybody is going to bleed when they have microneedling done. Some people will bleed like crazy. Other people will not bleed at all, and they're just going to be pink. You do not need to bleed to have a great treatment of microneedling. Depth is super important. And we also don't want to overtreat. You should really be only having on healthy, intact skin. So if I were to be sitting here right now getting microneedling done, I only need 3 passes. That's it. That's going to give me enough of that controlled trauma to give me that nice cascade of growth factors to give me the results that I'm looking for. If you have thickened scar tissue, you might need a little bit more, maybe even upwards of 6, but like spot treated really carefully. If somebody's just going to town, just like ripping up your skin, you're literally just causing damage and you're not getting the benefits. It's what I'm going to call uncontrolled inflammation, because now you're just causing a lot of trauma. The trauma that we're creating is micro trauma, and it's controlled and for a purpose. So you really don't need to go overkill with this. So with that being said, I like to call it controlled trauma, controlled inflammation, and then gross trauma and gross inflammation. Now, as a general rule of thumb, you can't have healing without inflammation, but you can absolutely have inflammation without healing. And that's when you get into a really nasty cascade and a circle. And it's just like this feedback loop of just inflammatory processes happening without reaching that really nice endpoint of collagen stimulation and full wound healing and proliferation. So you can't overdo it when you're trying to give somebody a really great treatment. You're just going to get them into that bad cycle and create trauma into the skin. All right, so moving on from the skin pen, next up we have the addition of radio frequency. This is what everybody's aware of now, is that RF microneedling, or radio frequency microneedling. And this is giving the addition of heat into that treatment. And this is coming on not just a little skin pen, but it's going to be more of a handpiece with a cord attached to a device that is plugged into the wall. So we're utilizing that electricity to create radio frequency heat energy, and that heat is going to be emitted from the tiny little microneedle cartridge, from those needle tips, from that device. So the way that I like to look at skin pen microneedling versus the radio frequency microneedling is ultimately, what's our goal here? So RF microneedling, I like to think of more as a delivery mechanism for radio frequency versus straight microneedling. So when we're doing skin pen microneedling, we're getting that really great cascade of all of those growth factors. And with RF microneedling, because we are adding heat will have a slight denaturing effect to those growth factors and proteins that are being made by that injury. So when the needles are entering the skin during RF microneedling, we're still stimulating that whole cascade that we got with the skin pen. But now, because we've added that addition of heat, it's going to kind of cook a little bit like an egg. So it's going to deactivate some of those growth factors, not all of them, but some. The main reason that we're doing that RF microneedling is because of that heat. So what that heat's doing is the needle's going into the skin, and then we're getting heat emitting out and creating a controlled thermal injury. And that controlled thermal injury in that dermal layer of the skin is going to create contraction. And that contraction is ultimately going to lead to skin tightening. So when we're looking for true skin tightening, that's when I'm going to reach for my RF microneedling. Now, does RF microneedling also work really good for scars and other indications as well, and acne? Yeah, absolutely it does. And it's for sure an option, but it's not the only option. So think RF microneedling, think skin tightening as the number one indication, and know that you can use it for other things as well. Now, when we're doing RF microneedling, we're not necessarily going to be using all the same serums and lotions and potions that we're using to drive into the skin. We want the skin dry when we're doing this RF microneedling. After the fact, once that's all done, then absolutely, you can totally 100% go and put all sorts of different stuff on top. You can put your HA on, you can put your sterile growth factors, you can put your exosomes on. All of that will then soak into those little tiny microchannels like a sponge and help improve all of your treatment effects and also help reduce downtime depending on what you're using. Now, once again, depth does not equal a better treatment. The deeper you go, it's not going to give you a better treatment. So if you want to give somebody the best treatment, you need to think about the dermis and where is it? How thick is their skin? What part of the face or body are we treating? That's going to tell you where that needle needs to go. If we're going deeper than that, with some devices at least, you do risk actually burning out some of that adipose tissue or that fat. And we want facial fat, okay? We want this. We don't want this to get burned out. Otherwise, we're gonna get sunken and gaunt and we're not gonna age well. So deeper is not better. You can actually cause complications with it that way. Now with RF microneedling devices, the types of needles can vary. They have insulated and non-insulated. So insulated needles ultimately have like a little coating on a majority of the needles and just the tips are naked. So just from those tips is where that energy is getting emitted from to create that thermal injury. Now with non-insulated, there's still a tiny little area on the needle that is going to be technically insulated because we don't want to cause damage to the top layer of the epidermis, but along a longer piece of that needle is going to be naked. So you're going to get that heat distribution through a larger column of the skin, which can give a better result. Also potentially comes with slightly more complications for what we call PIH, or post-inflammatory hyperpigmentation. So it can create, especially people that are melasma prone, they want to be really careful with heat. Anything with heat in the skin can potentially trigger melasma. Now, the device that I use is called Pixel 8, and Pixel 8 is made by Raw Aesthetics. And one of the reasons that I really, really like them is, one, I can get insulated or non-insulated tips. And two, they have this really cool function on the device called a pulse delay. And what pulse delay is if you think about the needle going in, we tell those needles how long to stay in the skin. So how big is our thermal area of injury going to be? But now we have a hot needle in here, okay? This hot needle is sitting in the skin. And if it were to just come right out, it's dragging that heat right through to the surface of the skin, and we're still causing damage. With pulse delay, that needle goes into the skin and it's going to give its energy, and then it's going to take a breather. That's pulse delay. And now the needle comes out. So it gives it that extra time to cool down inside of the skin before it drags out to the surface. So think of pulse delay as just taking a big deep breath before that needle comes out. So that makes the use of insulated needles a lot easier on skin types that are still prone to PIH. So I do love my device for that reason as well. Now, not all of them do have that. I'm sure other devices have something of the sort on there, and if they don't, then you should, and you should absolutely be redesigning your devices to have that great feature. Because I do genuinely believe that you get a better treatment using non-insulated needles versus insulated. And that is just my 2 cents on it. Now, discomfort and downtime when it comes to RF microneedling, they vary drastically, and they vary drastically based on the device and the brand itself. There are some devices like my Pixel 8. I use a topical numbing cream, and that topical numbing cream stays on for about 15-20 minutes, maybe up to a half an hour, and nobody needs anything else. Nobody needs nitrous oxide. Nobody needs nerve blocks. Everybody's comfortable. Within the first couple of pulses, everybody says, oh, this is fine. You can even treat areas that aren't numb, and you're still okay. Are you going to feel it a little bit more? A little bit, but you're still fine. And the thing that I love about that is that it's comfortable, has minimal downtime. You're pink for maybe a day, maybe a day and a half if you're sensitive, and then you're healed and you're done. And you're still getting a killer result. That's the thing, is that with these new devices, you don't have to have pain and downtime to get a great result. So I call that a huge win. Now, there's some other devices, and I'm not going to name names on this, okay? I'm going to talk about my good one, and that's it. But there are some other devices out there that are notoriously known for being extraordinarily painful, needing the use of nerve blocks or subcutaneous lidocaine, and can leave you remarkably swollen, bruised, and have downtime for days to a week. I don't know about you, but I don't really have a desire to have that type of treatment done, or have to go through all of that for my patients. I want my patients to be in and out as quickly as they need to. I'm not trying to keep them here with me all day. I may love them, but they don't need to be here with me all day. I want them to have a safe, effective treatment that's going to be comfortable. And that's what's going to keep you coming back is comfort and efficacy. If you can get a great treatment, love your results, and not be in pain the whole time, I mean, I call that a win. So if you're looking to have RF microneedling done, really look into the different types of devices and, read reviews, see what other people have to say about it, and ask your provider which one that they have, because they're not all built the same, and they're not all going to give you the same results or have that same comfort level as well, or downtime. So they're all different. Now, how many treatments do you need? I never start with less than 3. Okay, so everybody that starts on these protocols is going to start with a minimum of 3 treatments, and those are going to be spaced out about every month to month and a half, depending. Now, when I say minimum, that is a minimum. Some people will require more than that, and some people will need upwards of 6. If we're treating scars, you may need more than that. So everybody's super independent with what their needs are, and your provider should be giving you really custom expectations for what to expect. Now, maintenance for this, after you do your series of, we'll call it 3 to 6, after that, you're going to see final results coming in 3 to 6 months. You're very likely, at least with my device, going to see results a lot faster than that. But final collagen stimulation does take a little bit further for time. And so 3 to 6 months is when you're going to see that maximum effect. With any sort of collagen stimulating device, no matter what it is, 3 to 6 months is pretty typical. So that means if we think about that, you should be getting something done to stimulate your collagen every 6 months. If you're doing something twice a year to help maintain what you've already worked at, you're going to be way ahead of the pack, and doing your treatments isn't just going to fade away and start aging again. Because if you do your series of 3 and then you do no maintenance for it, you've kind of wasted it. Now, you've anti-aged for a short period of time, but then you're going to out-age your collagen degradation versus being able to kind of rejuvenate and fill that pot back up. So you always want to do maintenance treatments. After you do your series 3 or 6, you're not done yet. Okay, so let's talk skincare products in the pre and post care periods. So in prepping your skin for treatment, now let's be realistic. Is everybody doing this? No, but I'm going to tell you what the ideal skin prep would be to getting you ready for microneedling treatments, whether it's RF or skin pen. So we don't want to just take somebody's skin that has never had anything done before, does not use medical grade treatments, is using Neutrogena and Clean and Clear, and take them from that and all of a sudden be doing these medical grade energy devices on them. They're not going to get a great result, as great as it could be. And 2, or B, however I'm counting this here, you could actually potentially create some extra trauma to the skin, and the skin's just not going to be healthy and ready. We really do have to get your skin prepped and healthy to give you the best outcomes. And that can be done by putting you on medical grade skincare. We can do some chemical peels. We can start you on a retinol for a few weeks ahead of time. Anything to start to get your skin cells to kind of wake up and start regenerating. We want to get them out of their dormant phase and get them really boosted and healthy. Once we get your skin healthy, then we'll taper you off of your retinol. We want you off of retinol for at least 5 days before treatments. And then you can start that back up. Patient depending. I mean, if you're in series, just stay off the retinol. Once you're done with your series, you can start back on that, typically after about a week or 2, depending on your skin type. Now, post-procedure, can't forget this, prep. One of the most important products that you can put into your skin prep regimen is going to be elastin nectar. And this product we also use post-procedure, but in the pre-procedure arena here, what it's doing is it's going to go in and it's going to get into that basal layer of your dermis, where it kind of is the collagen and elastin graveyard, where all the broken and junked up and gelatinous gunk is sitting and not allowing your skin to regenerate and be new and fresh. That gunk that's sitting there, the elastin nectar will go in and help clear that out. So they're like the garbage men of your skin. So that nectar is going to go in and really clean house and make it so that you have a fresh slate. So when you're doing these collagen stimulating procedures, you can get even more collagen stimulated. So it's a great way to maximize. If you start using the elastin nectar 2 to 3 weeks prior to each procedure, golden, great. 1 to 2 pumps twice a day, good to go. Now, back to post-procedure, again, elastin nectar. It's a great one, especially if you're sensitive, especially if you really want to reduce your downtime. Elastin nectar works great for that. Again, 1 to 2 pumps twice a day after cleansing. Now, there's a variety of other brands that you can use in your pre and post-procedure care. The main thing is make sure, because we created a wound on your skin, you may not look like you have a wound, but you have thousands of holes in your skin, that whatever you're putting on is safe to put on. So things like growth factors, exosomes. I personally love the brand Epicutis. They make a post-procedure kit that is to die for. It's all based off of their lipid serum. They give you a nice cleanser to use. Lipid serum is very anti-inflammatory. Their Hivea cream is hydrating, and then they give you a great lipid mask as well. That mask is, it's so heavenly. I want to do a whole episode just on lipid mask. It's so good. But there's a whole variety of things that you can use, but the main thing is to be gentle, and you need to use something medical grade. So when I'm doing procedures with energy devices and lasers, your post-procedure skincare is built into the cost of your procedure. And I'm not doing that to try to shake you out for more money. I'm doing that so that you get the results that you're looking for and you don't cause damage to your skin. You cannot just go back to using Neutrogena and Clean and Clear or even La Mer or other things from Ulta or Sephora or CVS. You cannot do that. You really need to ask your medical provider who's going to be giving you these services what you should be using on your skin before and what you should be using after. And if they're trying to sell you something, it's for a reason. They're not just trying to upsell you. They're trying to help take care of your skin. So for providers, if you're listening, bundle it in. Just bundle it in. It's negligible. Get travel sizes of things. That's what I do. Travel sizes of all the products that you want them to use post-procedure. That way you're not shaking them out for cash and you're getting just what you need to help keep their skin as healthy as possible in the post-procedure phase and help them heal faster. So ultimately, that's my spiel on microneedling. So how do you choose which one you want? Isn't that the main thing now? How do you know? Am I doing Skin Pen or am I doing Pixel 8 or another RF microneedling device? I mean, there's no real great right or wrong answer. You can do what you want. I mean, you can do which one you love. Try them both out. See what you like better. But ultimately, my rule of thumb is skin tightening, RF microneedling. Simple as that. Everything else, we can get there. If pigment or sebaceous glands or things like that, try Skin Pen. Honestly, it's a little bit more affordable. It's a fantastic treatment. I really don't agree with any providers that say that Skin Pen is antiquated technology. I don't think it is at all. I think it has a wonderful time and place for skin, and especially with the addition of all the different types of exosomes and treatment boosters that you can use now. A lot of that has come a long way. So being able to really get those ingredients in your skin, I mean, it's a home run. It's an absolutely phenomenal treatment, and I don't think you're missing out on really anything by doing Skin Pen, unless you're just looking for skin tightening. But all right, that's it for episode 1 of season 2. Thanks so much for hanging out with me here. A quick and dirty one here today. And if you have any questions, you can find me on Instagram or you can send me an email. Emails will go to justapinchpodcast@gmail.com. You can find me on Instagram at justapinchpodcast or at Injector Kristin is the main one, or at Ethos Aesthetics. See you next time.